Hello everyone. This presentation will focus on information architecture of public health systems and will be presented by myself, Antoine Orses-Guerra, and Mark Tam. So what do we mean by when we talk about information architecture of population health systems? What we really want to focus on is utilizing health information exchange capabilities and interoperability, which helps facilitate the exchange of health data for various population health uses. And the reason why we want to focus on health information exchange and interoperability is because of how our healthcare system in the United States is fragmented with various differing healthcare institutions and organizations that have different types of information architecture. So what we mean by interoperability is the ability of computer systems to transmit and receive data as well as to make use of that data as information. And in terms of semantic interoperability, the focus is on vocabulary or language of the message within the package, as well as the interpretation of meaning, giving meaning to data to make that useful information. And in terms of syntactic interoperability, we're focusing on the structure and type of package or envelope transmitted. So this could include specific formats such as extensible markup language, XML, or even the use of standards such as Health Level 7. And finally, when it comes to technical interoperability, we're talking about the method by which the package is transmitted, as well as the security services provided by the entity handling package delivery. The whole point of standards for population health informatics is to enable the various types of interoperability described in the last slide. Now, this is so that two systems use the same set of conventions for the transfer of data or information. So when it comes to syntactic standards, again, we're focusing on the type of information transmitted. So some examples of syntactic standards include Health Level 7, which is the most widely recognized and adopted syntactic standard in health informatics. And of course, there's other EHR standards. There's DICOM, which is the Digital Imaging and Communications in Medicine for medical images, NCPDP, which is the National Council for Prescription Drug Programs for pharmacy services, and so on. Now, when it comes to semantic standards, again, we're focusing on vocabulary, language, or interpretation of meaning. So think of terminology, such as like a body of terms used with a particular technical application. So an example of commonly used terminology standards in healthcare include CPT, which is the current procedural terminology, or ICD, which is the International Classification of Diseases. Health Information Exchanges, or HIEs, which are enabled by interoperability, is defined as the electronic transfer of clinical or administrative information across diverse and sometimes competing healthcare settings. There are four dominant types of HIE structures, the first of which are private HIEs, where a health system interconnects its affiliates and therefore the exchange is only within the membership group. The next type of HIE is a government-facilitated health information exchange, where state governments or other publicly funded organizations act as a main facilitator of HIE within state boundaries. Community-based HIEs are where the exchanging of data among providers and healthcare organizations are made by those who may be unrelated or who may not have a financial relationship. And this is done because of the fact that these organizations have recognized and observed patient crossover, which leads to repeating tests and procedures for patients who receive uncompensated care. So in this instance, if each organization is more aware of their patient's history, they might be able to induce some cost-saving measures while sparing patients from unnecessary care. Now, the last type of HIE is a vendor-facilitated HIE, which is a hybrid of government-facilitated and community-based HIE. But in this instance, the vendor does not typically facilitate the governance structure of the exchange. It simply just provides a technical pathway for the HIE. So again, this is just more so where an HIE is facilitated by an EHR system vendor. Now, this specific slide refers to the fact that patients want to have a certain degree of trust when it comes to their protected health information or their personal identifiable information being stored appropriately by their healthcare providers as well as their health institutions. So in this instance, we have standards specifically within social and political foundations, whereas health information exchange requires contracts, laws, regulations, which thus increases trust in these health institutions by patients to store protected health information. And there are three principles of focus when it comes to these social and political foundations, the first of which is privacy, which is the right to choose what information is shared or not shared, confidentiality, which is the duty to keep information secret, and then finally security, which is the use of administrative, technical, and physical safeguards ensuring both confidentiality and privacy. Now, in terms of technical foundations, there is a necessity for performing population health functions, in which we do have various software applications or foundational HIE technologies, such as MPIs or a master patient index, or a health management information system, such as an HMIS, or even just a shared health record.
Through these foundations come formations and applications of numerous versions of health information exchange systems. Within the US itself, there are very numerous versions of these systems. Two applications in particular come to mind as being the most notable and popular are care coordination alerts and population health dashboards. Care coordination alerts focus on improving coordination across health systems that have been fragmented. One essential example of this is ADT Alerts, which is a medical alert system very similar to how an iPhone for Apple gives an alert for a missing child or a missing persons or alert weather. Essentially, a message is sent prior to hospitalization and visit in order to improve the health professional's diagnosis time and to avoid resources spent needlessly as they would if they weren't given the information prior to the patient's arrival. This leads to the prevention of rehospitalization in the future of that patient, as well as unnecessary resource consumption. The concept behind care coordination alerts is that information that is retrieved or given can lead to trend awareness or strong awareness of the situation slash afflicted disease or other kind of health problems, and that will lead to better management of the population health. And population health dashboards or electronic health records, health indicators are tracked per population or subpopulation. Key differences of gender, age, race, or other socioeconomic factors that can affect health are monitored in the population, and then they can be divided down or narrowed down to find key differences between population and subpopulation in order to monitor things such as differences in rates of immunization or mortality rates or other kinds of prevalence or incidence for a population or subpopulation. There are numerous challenges in implementing health information exchanges, 5 in particular of costs, resources, privacy, interoperability, and competition. For costs, it essentially is high cost that comes with implementing software and hardware and training staff in order to maintain that hardware and software. There's also a time in which productivity is concerned to be lost and produce lower revenue due to the transition of going from one system to another. For resources, this essentially concerns the fact that small local providers do not have the same technological resources as more financed, more funded institutions to accommodate health information exchanges. Another concern is privacy. in which concerns of illegal access and breach of confidentiality outweigh the benefits of healthcare. Interoperability refers to how data exchange between networks can be ineffective and how information can be blocked or mismanaged, and health institutions cannot be able to work together, which will lead to interoperability. And finally, competition, in which vendors can cause that information blocking because of their business policies so that they don't share data in order to preserve their own business because they do not enjoy other competitive markets slash other quote unquote rivals slash other healthcare organizations and institutions to have the same data as theirs. We've taken a look outside of the United States into South Africa with this particular journal article that is a literature narrative on health information systems for low and middle income countries. It concerns with how technological advances and information technology have a giant purpose in the health sector, in which it extend geographic access across the fragmented healthcare system in South Africa. It can enhance client communication with the health provider, improve diagnosis and treatment time and efficiency, improve data management, and avoid fraud and abuse client confidentiality. As previously said, it also goes about challenges and benefits. Or other terms it goes with is enablers and barriers. Some enablers include legislation, political leadership, staff training, financial investment, the acceptance of technology, its performance, and social influence among health professionals. And challenges, which previously said before, of the complexity of the intervention and lack of technological consensus, limited human resource, management and funds, inadequate capacity, poor application and staff resistance, and compromised data quality. This article goes further to explain how there's a need for well-defined roles to ensure successful implementation and utility. And by that, it talks about how there's a need for organizations, institutions to have a better understanding, shared understanding of its hierarchy and levels of organization so that information culture can be properly cascaded, reviewed, and inferred so that there's a proper implementation of electronic health information systems and make sure that it's properly utilized and continuously improved, which can be seen on the next slide. Here in Figure 2, it shows the well-defined roles and responsibilities of the different hierarchy levels in an institution slash organization. This is to ensure efficient utility of electronic health information systems for disease diagnosis and treatment in low and middle income countries. As we look towards the future, it is impossible to understand and monitor population health without data integration across multiple resources. There's a great need for that, as well as a great need for interoperability, as well as health information exchanges. However, the number of people specialized and efficient in this kind of data integration versus the people who are actually in it, the skill level disparity is very high. It's very comparable to comparing a professional athlete to a college athlete. However, more programs are offered each and every day in regards to training in that field. And efforts by the United States government for nationwide exchange in health data has led to a stronger investment and convergence of market players such as tech companies and EHR vendors, which also leads to new emerging standards. This bodes well for the future of health information exchanges for the United States as well as the world.